Thank you so much. Let me introduce a little bit myself. I am Andrea Bernini. I live in Brescia in the north of Italy. And let me tell you a little bit about my professional background. I am not a professor and I'm not a researcher. And I have never been an ICU nurse until last year spring. I worked all my life in operating rooms. And last year, because of the explosion of the COVID pandemic here in Brescia, the nurses necessary to open the new ICUs came from many realities and many times from operating rooms. That's because we were able to manage intubated patients. So I'm not here to teach you new high technology or new taking care procedure about COVID-19 patient. I'm just here to tell you a story, my personal story, the story of a citizen and a nurse. And I want to share our personal story of me and my wife, because she is also a nurse and she has the same professional background. So, a little bit of objective data to describe the situation in February 2020 here in Lombardia. Lombardia is the most populous region in Italy, and it takes about 1/6 of the national population. And it also represented the first health power system in Italy. It means that many people moved to Lombardia searching high availability of health services and high performance of them. The Italian health system is free for the citizen and so available for everybody. It is the constitutional law. So hospitals are a mix of public and private. 70% are public and 30% are private. This was also a part of the problem last year, but this is another story. So in February 2020, COVID-19 was a Chinese situation, a Chinese problem, so far away from us. We hadn't idea it could strike here, and of course, not here first. Winter activities like ski were full of people. And here with me, you can see one of the physicians who I worked with, and I would like to thank her, Silvia Barbieri. Thank you for the help for this webinar. We had together the last ski activity last February with a surprise. The access to the ski lifts was 50% limited. So back in 2020, the cities were preparing the Carnival manifestation for the last day of Carnival, Sunday, 23rd February. But a few days before, on Friday 21st, we got struck in. The first COVID positive patient was found in Codogno, in a South Milan town. So the Carnival celebrations were interrupted around midday in many cities and towns of north of Italy. Children didn't go back to school from Carnival holidays. So the first containment measures were in action, school closed. And also started an unknown patient flow to the hospitals with strange pneumonia. We were completely unprepared. The alert communication coming to hospitals were talking about an infection similar to 2002 SARS-CoV pneumonia. In the whole country, we have had only 4 positives in the first years of the millennium. So in last February last year, we had no large stocks of diagnostic swabs available. We had no big numbers of DPI available in the health structures, and especially we had no know-how. This graph, made in summer 2020, showed the most realistic scenario in Lombardia at the end of February 2020. The pandemic was already in action here, but we were not aware of it. When the epidemic tracking activity showed the history of the disease in our region, we understood that the containment measures had started too late. COVID was running through our territories from months and months. So it was too late for containment. Some dates: 21st February, patient 1 in Codogno, 22nd, a red zone were established in the South Lombardia areas. In 23rd, schools and university got closed in Lombardia. On 4th March, schools and university closed in the whole national territories. On 7th March, Lombardia started the total lockdown. And on 11th March, Italy started the total lockdown. It was the strongest in the history of our republic. So the big question was, what's the plan? We had no plan to manage the situation. Every day, the department's manager made emergency meetings. Every day, new rules. Every day, new procedures and activities. Every single new day. All the non-COVID health activities stopped. The essentials were reduced to the 20% of their capacity. And health professionals were progressively moved to the ICUs. All the food services in the hospital for the workers stopped in the end of February, and we had only packaged food. But the restaurant owners of the city provided food and amenities. Here starts my personal story. Every time there were not available ICU bed in our hospital and in the hospitals in the 100 kilometers ray areas for the COVID patients, we transformed the surgical areas recovery rooms in temporary ICU. The work of the builders, of the volunteers, of the citizens realized the impossible. An outside and outdoor temporary world for patients waiting for a bed place inside the hospital building was realized. All the ICU were transformed to COVID ICUs to face the surge of the patients. We also increased the ICU's beds capacity numbers. At the same time, we created a couple of new emergency temporary COVID ICUs. The migration of the nurses, emigration of the nursing from the operating rooms to the emergency COVID ICUs was possible thanks to the stop of the planned surgical activity. My wife moved to the ICU on 6th March. And here in this picture, you can see the old laundry building of the hospital transformed in an awaiting ward. The patients were awaiting for a bed inside the building. So I started my experience in the ICU on 20th March. A race against time started to recover and prepare areas, beds, medical devices, nurses, physicians, to create new COVID ICUs. And I'm here to share my personal experience, and I want to show you this side of the story. My dad got sick during the hardest days. Everything started with an erysipelas infection, and it lasted 1 month long. And after 3 weeks, he also had interstitial pneumonia with the negative swabs. So before every night shift in the ICU, before working time, I went to see him and get him connected to my mother. He finally came back home after Easter. And also the family of my wife's sisters, a teacher, was in trouble with COVID-19. The situation was this one. The transport and the logistics systems were not available, so all the organization was internal. When new ICU places were absolutely necessary to get started, every day an abandoned ward was identified and then became as fast as possible an ICU. Here you can see the beginning of the works. And every day we were treating the patients with a temporary wood wall dividing us from the construction site and the workers. In those places, my wife and I started our ICU activity in the month of March. This emergency ICU was realized in an abandoned operating room area in front of the ordinary ICU. I started with a night shift after an only one training day in a non-COVID ICU. I wasn't an expert in dressing myself with COVID DPI, so I simply copied steps and movements of the other expert nurses present. The ward was obviously full with 16 patients present. We were 2 training nurses and 2 experts. Each of us had 4 patients in charge. During the handover with my colleague, I was completely shocked about. I have no idea what I have to do to let them survive until the next morning. 2 of them were receiving CVVH therapy. One was prone and one had delirium after weaning from sedation period. He was trying to remove his tracheostomy. I was, as I told you, in an old operating room, and it was my old operating room, rapidly destroyed and adapted to become an emergency ICU. No windows, no air cooling or heating, not enough electric plugs for all the beds, and not enough oxygen plugs for all the beds. We had a small sealed window that was used to communicate with the operator outside in the yellow area. After the handover, I was almost frozen, standing in front of the beds, sweaty, unable to see correctly because of the glasses under the DPIs. I was standing with some papers in my hands, wearing triple gloves. The nurse colleague in the next room was an expert one. She also has, of course, her 4 patients, but one of them was in palliative treatment, unfortunately. She saw me in total blackout. She came to me asking if I was needing some help, and she took the